It causes roid rage. It's a magic bullet for fat loss. It's just for bodybuilders. The internet is a minefield of misinformation about testosterone replacement therapy. These lies stop good men from getting the help they need, or push them into making dangerous decisions. In this video, we are taking a sledgehammer to the 5 biggest lies about TRT. We'll replace each lie with cold, hard, scientific fact. These myths are more than just confusing. They are actively dangerous. When you are serious about vitality after 60, you cannot afford to waste time chasing false promises. You also cannot let fear of exaggerated side effects prevent you from having an honest conversation with your doctor. That is why we built Gentleman's Vitality, to cut through the noise and deliver actionable, science-backed truth. If you want more strategies to boost your energy and master your mobility, subscribe now. Let's start with the misconception that drives the most fear and confusion. This is the lie that often keeps men stuck on the sidelines, living with unnecessary fatigue and low motivation. The lie is that TRT is simply a performance-enhancing drug used for vanity. It is often bundled with images of young athletes and extreme muscle gain. This comparison is not only inaccurate, it completely misses the point of therapeutic hormone treatment. The first lie we must confront is this: TRT is just a steroid for old guys. The truth is, TRT is about replacement, not abuse. Think of it like a diabetic using insulin. They are not trying to get an unfair advantage. They are replacing a hormone their body no longer produces efficiently to restore a normal, healthy function. When you are 60 or older and your body is producing clinically low levels of testosterone, TRT aims to bring those numbers back into the normal physiological range for a healthy man. This is the definition of therapeutic dosing. The goal is not massive, sudden muscle growth like an athlete trying to win a competition. The goal is to feel better, have more energy, retain muscle mass, and improve cognitive function. It is a medical treatment designed for health and longevity. Your doctor will be targeting a specific, healthy range on your blood work, not pushing the limits. Understanding this difference is the crucial first step toward making an informed decision about your health. If your testosterone is genuinely low and confirmed by proper blood work, replacement is restoring your body's natural balance. Now let's talk about the second biggest scare tactic used online. This one involves your mental state and is often cited by those who confuse replacement with abuse. Lie number 2 is, you'll be angry and aggressive. You'll get roid rage. This myth is based on the misuse of anabolic steroids in incredibly high doses. It has almost no correlation with properly monitored therapeutic TRT. In fact, the science often shows the opposite effect. Men with genuinely low testosterone often suffer from increased irritability, mood swings, and even symptoms similar to depression. When testosterone levels are corrected through careful replacement therapy, many men report a significant improvement in mood stability, calmness, and motivation. Think about it. When you feel stronger and have more energy, your patience naturally increases. You are not fighting constant fatigue. Your mental clarity improves. If a man experiences increased irritability on TRT, it is almost always due to improper dosing, specifically levels that spike too high or drop too low between applications. This is why regular, comprehensive blood testing with an experienced physician is non-negotiable. Proper medical management controls your symptoms and maintains hormonal harmony, preventing those dramatic mood shifts. If you are struggling with low energy and unexpected irritability, it is time to have your hormone levels checked. The third lie is highly appealing because it promises an easy fix to a frustrating problem. Lie number 3 is TRT is a guaranteed fix for erectile dysfunction. While testosterone is absolutely essential, this statement is misleading. Testosterone is the master hormone for libido or the desire for intimacy. When your testosterone drops, your sex drive often declines first. TRT can be extremely effective in restoring that drive. However, erectile dysfunction, the physical inability to achieve or maintain an erection, is often a vascular problem. It is related to blood flow, nerve health, or other underlying issues like diabetes or cardiovascular disease. If your testosterone levels are good but you still experience ED, TRT will likely not solve the problem completely. The best approach is comprehensive. TRT can boost your desire and improve the quality of nighttime erections, which is important for tissue health, but it may need to be coupled with other treatments, especially if the root cause is cardiovascular health. Do not assume TRT is a magic pill for physical function. It is the fuel for the engine, but it does not fix the road the car drives on. Always look at your overall cardiovascular health first. Speaking of cardiovascular health, let's move to the most serious and complex myth. This lie concerns your long-term health and is the reason many doctors are hesitant to prescribe TRT. Lie number 4 is TRT increases your risk of heart attack and stroke. This is where you need clear, evidence-based science. This fear largely originated from 1 or 2 older, flawed studies that showed confusing results. Since then, numerous long-term, better-designed studies have clarified the picture. For men with confirmed low testosterone, restoring those levels to the healthy range may actually be protective of cardiovascular health. Low testosterone is linked to increased visceral fat, poor insulin sensitivity, and chronic inflammation, all known risk factors for heart disease. By correcting low T, you may improve body composition, blood pressure, and overall metabolic health. However, here is the critical caveat. TRT can sometimes increase the number of red blood cells, a condition called polycythemia, which can thicken the blood and raise the risk of clots. This is a real risk. A responsible doctor manages this risk with careful monitoring of your blood work, specifically your hematocrit levels, and may recommend blood donation to keep it in check. The key takeaway is, low testosterone is itself a risk factor for poor heart health. Properly administered TRT, under strict medical guidance, is generally safe and often beneficial for metabolic health. The difference between danger and safety is always proper monitoring. The fifth and final lie deals with the seriousness of the commitment. This is particularly important for men over 60 who might be hesitant about long-term medication. Lie number 5 is, you can stop TRT whenever you want. This is a deep misunderstanding of how the body's endocrine system works. When you introduce external testosterone, your body sends a signal to your testicles to stop producing their own. This is called the negative feedback loop. Therefore, once you start TRT, your natural production effectively shuts down. If you suddenly stop, your body will be left without any significant testosterone, leading to a period of severe symptoms, potentially worse than before you started. Your body may eventually restart production, but it is a slow, difficult, and uncertain process, especially as you age. TRT should be viewed as a long-term commitment, much like medication for blood pressure or cholesterol. It is not an antibiotic you take for 10 days. If you start, you must be prepared to stay on it indefinitely to maintain the benefits and avoid crashing your system. This is why the decision to start must be made carefully with a doctor who specializes in hormone health, ensuring you are committed to the long-term monitoring required for safety and efficacy. So we have debunked the lies. TRT is about replacement. It improves mood, it fuels libido but doesn't guarantee erections. It is safe when monitored for cardiovascular risk, and it is a commitment. Now let's address the most common objection. Why should I bother if my doctor says my numbers are normal for my age? This is a vital point for the man who is experiencing symptoms but whose doctor uses wide, outdated reference ranges. The reference ranges for testosterone are often very broad, sometimes encompassing the levels of a healthy 20-year-old and a very frail 90-year-old. Your doctor may tell you your testosterone is 350 nanograms per deciliter, which is technically normal. But if you are highly symptomatic, fatigued, depressed, losing muscle, that number is only barely normal. The trend in modern, specialized medicine is to treat the patient, not just the number. If your T level is 350, but you feel like a 90-year-old, treatment that raises you to 650 may be medically indicated and life-changing. Do not settle for normal for your age if you feel terrible. You deserve to feel vital and strong. If your doctor dismisses your symptoms based only on a wide lab range, seek a second opinion from a physician who specializes in hormone optimization. Remember that TRT is not a replacement for healthy living. If you sleep poorly, eat processed foods, and avoid exercise, TRT will not be the magic bullet advertised in those online scams. TRT works best when it is the powerful foundation that supports an already disciplined lifestyle. It gives you the energy and motivation to get back into the gym, which in turn amplifies the benefits of the medication. Think of TRT as the turbocharger on a well-maintained engine, not the fix for an engine that is seizing up. The best results always come from the synergy of medical intervention and personal responsibility. The ultimate goal here at Gentleman's Vitality is to empower you to take control. Now that you know the truth, the next step is crucial. If you recognize the symptoms of low T in your life, do not self-diagnose based on a simple web search. Start the process correctly. Ask your doctor for comprehensive blood work, specifically checking total testosterone, free testosterone, estradiol, and hematocrit. This is the only way to establish a baseline and determine if replacement therapy is medically indicated and safe for you. If this video gave you clarity and cut through the confusion, please like the video so more men can find this factual information. Subscribe for daily evidence-backed strategies. Taking control of your hormones is one of the most proactive steps you can take for a stronger, healthier, and more vibrant life after 60. You are capable of regaining your energy, and we are here to help you master that journey. The decision to pursue therapy should always begin with data. You need to know exactly what is happening inside your body. When you go for your blood draw, request that the blood be taken in the morning, ideally before 10 a.m. This is when testosterone levels naturally peak, giving you the most accurate reading of your natural, highest output. A low reading taken in the afternoon might simply be a reflection of that natural decline, not a true deficiency. Getting the test done properly ensures you are starting your investigation with reliable facts. Once you have those numbers, it is time to look at the second vital factor, time symptom severity, DIME-SIMS. A number only tells half the story. If your testosterone is borderline low, but you are experiencing profound fatigue, significant loss of strength that cannot be explained by poor training, and severe brain fog, your symptoms outweigh the numbers. Conversely, some men have very low numbers but feel reasonably fine. In that case, treatment may not be necessary. You must treat the patient, not just the lab sheet. This is the conversation you must be prepared to have with your doctor. A frank discussion connecting your blood work to your daily reality. Remember, low T is officially called hypogonadism. It is a recognized medical condition, and it deserves treatment just like any other hormonal imbalance. Let's revisit the commitment issue, as this is the one that causes the most regret. If you begin therapy, you are entering a relationship with your health that requires consistency. You cannot skip doses or take breaks without serious consequences for your well-being. This requires a small adjustment to your routine, whether it is applying a gel daily or administering an injection perhaps once or twice a week. The men who report the best results treat this schedule with the utmost respect. They do not view it as a burden. They view it as the simple maintenance required to unlock their energy and vitality. Another common concern we hear from men over 60 is about injection fear. Many men worry about self-administering needles. This is a legitimate concern, but it is important to know your options. Testosterone is available in several forms, each with pros and cons. There are gels applied daily to the skin, which many men prefer for convenience and comfort. There are also injections, which are highly effective and deliver very stable levels, often only needed once a week or every 2 weeks. There are also pellets inserted under the skin that last for months. Discuss all these delivery methods with your physician. They can help you select the method that best fits your lifestyle and tolerance for administration. The key is finding a method you can commit to for the long run. Stable levels are far more important than the specific delivery system. We talked about the roid rage lie. Let's dig deeper into the actual mental benefits. Beyond just reducing irritability, many men on proper therapy report a significant return of their mental edge. This means better focus, reduced brain fog, and a stronger sense of motivation and assertiveness. As testosterone declines, motivation often goes with it. The simple act of wanting to go to the gym, wanting to pursue a hobby, or wanting to plan a trip often returns first. This boost in mental drive is often the most appreciated benefit of all. It is the restoration of your inner spark, the drive that defines vitality. This mental benefit alone is a powerful motivator for men to explore treatment. The key to unlocking these mental and physical benefits while staying safe relies entirely on the second lie we busted: monitoring. A responsible TRT protocol involves follow-up blood work, usually every 6 to 12 weeks during the initial phase of stabilization, and then every 6 months once stable. What are they checking? They are ensuring your total and free testosterone levels are in that sweet spot, high enough to alleviate symptoms but not so high as to cause risk. They are checking your estradiol, which is vital because testosterone can convert to estrogen, and high estrogen can cause side effects. Most importantly, they are checking your hematocrit to monitor your red blood cell count and ensure your blood is not becoming too thick. This vigilant monitoring transforms a potentially risky therapy into a remarkably safe and effective treatment. This is the process that responsible medicine demands, and it is the standard you should accept from your physician. Remember that TRT is not a singular solution, but part of a comprehensive health strategy. Before starting any hormone therapy, you should ensure you are maximizing your body's natural potential. Are you optimizing your sleep? Sleep is when your body produces the most hormones. Are you managing your stress? Chronic stress elevates cortisol, which suppresses testosterone. Are you eating enough high-quality protein and healthy fats? These are the building blocks of testosterone. If you ignore these fundamentals, you are building your new vitality on a weak foundation. Take a moment right now and think about the one fundamental health habit you could improve this week. Start there. If you are currently subscribed to Gentleman's Vitality, you know we are committed to providing expert-backed strategies for men serious about their health. If you are not subscribed, hit that button and the notification bell now. We deliver new, actionable strategies every day to help you boost vitality and master longevity. We cut through the noise so you can focus on living your strongest life. Taking control of your hormone health is a monumental step. Do not let outdated myths or fear stop you from engaging in a productive conversation with a qualified medical professional. You deserve to feel your best, and modern science offers solutions. Find the right doctor, demand comprehensive testing, commit to monitoring, and get back to living with the energy and vitality you thought you lost. The reality is that age is not a diagnosis. We often hear the phrase, "Well, you're 65, what do you expect?" This is lazy medicine, and it is unacceptable. What we expect is health and vitality, provided we are serious about maintenance. Your focus should not be on accepting decline, but on identifying the underlying causes of that decline. Low testosterone is frequently one of those causes, and it is highly treatable. Let's briefly revisit the fourth lie about cardiovascular risks, but from a different angle: the protective benefits of muscle mass. As men age, we fight a constant battle against sarcopenia, which is age-related muscle loss. Maintaining muscle mass is non-negotiable for mobility, stability, and long-term metabolic health. Muscle is your body's best defense against insulin resistance and chronic disease. TRT, when combined with resistance training, offers a powerful advantage in maintaining or even building lean mass. This increase in muscle mass can have systemic benefits, improving your glucose metabolism and reducing overall inflammation, which are indirect ways of lowering heart disease risk. However, the key word is combined, Dembalaus. If you go on TRT and sit on the couch, the results will be minimal. The hormone acts as a facilitator. It turns the key in the ignition, but you still have to drive the car. This is why our channel focuses so heavily on strength training for men over 60. When your hormonal environment is optimized, your efforts in the gym deliver maximum returns. If you want to maximize your TRT benefits, you must integrate consistent, focused weightlifting into your weekly routine. Another important point often missed in the online discussions is the variability of symptoms. Some men primarily feel the energy benefits, while others notice the mental clarity first. You must manage your expectations based on your primary symptoms. If your chief complaint is low libido, be patient. That may take a little longer to fully restore than your mental motivation. If your main issue is strength loss, remember that muscle building takes time, regardless of the hormone level. Give the therapy a proper trial period, at least 3 to 6 months, before judging its effectiveness. The most profound changes in body composition are seen after that initial 90-day stabilization period. We also need to address the critical importance of estradiol, or E2, which is a form of estrogen. This is often ignored by less experienced providers. As testosterone is introduced into the male body, some of it naturally converts into estrogen via an enzyme called aromatase. If your estrogen levels get too high, you can experience side effects like water retention, moodiness, and even breast tissue sensitivity. For men over 60, managing estrogen is just as important as managing testosterone. A good physician will check your estradiol levels regularly and may use a specific class of medication to keep them in a healthy range, ensuring a smooth, symptom-free experience. If your doctor isn't checking your E2, that's a red flag. Demand comprehensive care. Finally, let's circle back to that fifth lie, the commitment. Because TRT is long-term, you must view your doctor as a partner. You need open, honest communication. If you feel too moody, or if your energy levels are spiking and crashing, you must tell them. These are signs the dose or the frequency needs to be adjusted. You are the only person who can provide that feedback. Do not treat your TRT journey as something passive. Be an active participant in your care. Your commitment to communication is what turns a good protocol into a great one. Ensuring your health remains the top priority. Let's consider the practical implications of selecting a TRT form, particularly for men in this age group. While gels offer convenience, they carry a small risk of transferring the hormone to partners or grandchildren through close skin contact. This requires careful application and strict washing routines. For many men over 60, the slight inconvenience of a weekly or bi-weekly injection is outweighed by the benefit of highly stable hormone levels and zero transfer risk. Stable levels translate directly into stable moods and consistent energy, avoiding the peaks and troughs that sometimes occur with daily topical application. Discuss these lifestyle factors carefully with your physician before making a choice. Another common myth involves the idea that TRT will immediately eliminate belly fat. This falls under the category of miracle claims. While low T is strongly associated with increased visceral fat storage, that deep, dangerous fat around the organs, TRT is not a liposuction injection. What it does is improve your body's thiamine senanamashiv to manage energy and build muscle. Fat loss is fundamentally driven by diet and activity. However, TRT changes your hormonal environment so that when you do exercise and eat healthily, the fat loss happens much more readily and the muscle gain is prioritized. It changes the efficiency of the machine, but you still have to put in the work. Focusing on quality protein, controlling sugar intake, and walking daily will dramatically accelerate any fat loss benefits derived from therapy. We must also touch on the specific relationship between TRT and sleep quality. Many men with low T also struggle with poor sleep, often linked to sleep apnea. While some reports suggest TRT can exacerbate existing sleep apnea due to increasing muscle mass around the throat, this effect is often dose-dependent and manageable. The positive flip side is that as your energy improves during the day, your body's need for recovery deepens, often leading to better, more restorative sleep overall. Again, this highlights the necessity of monitoring. If your physician knows you have sleep apnea, they should pay extra attention to your sleep quality during the initial months of therapy. Never ignore changes in your breathing or snoring. Open communication is the key to managing these adaptations. The most critical takeaway from debunking these 5 lies is the concept of personalized medicine. There is no standard TRT dose for all men over 60. The optimal dose for you is the one that resolves your symptoms, keeps your blood markers safe, and maintains your vitality. This requires nuance, patience, and a physician who treats TRT like an ongoing science project, not a simple prescription. If you are ever offered a one-size-fits-all protocol, walk away. Your health deserves customized attention. Remember the foundation we discussed: lifestyle. Before jumping into any hormonal intervention, commit 90 days to radical lifestyle optimization. Prioritize getting 7 to 9 hours of quality sleep every night. Eliminate refined sugars and heavily processed oils from your diet. Implement 3 days of heavy resistance training a week. If, after 90 days of absolute commitment, you still feel profoundly symptomatic and your blood work confirms low hormones, then you have done your due diligence. You are approaching TRT from a position of strength, ready to amplify your results, not just patch holes in a broken foundation. The truth about TRT for men over 60 is neither the miracle cure advertised in some corners of the internet, nor the dangerous risk painted by others. It is a powerful, evidence-based medical tool. It is effective when managed correctly, dangerous when managed poorly, and often unnecessary when lifestyle factors are ignored. You have the knowledge now to make an informed decision. Use it wisely. Let's discuss the specific tests that demonstrate responsible monitoring. When your doctor checks your blood in the first few months, they are looking for stability. They are not chasing the highest number possible. Stability is the hallmark of a successful protocol. Your total testosterone should ideally sit in the upper half of the healthy range, generally between 600 and 900 nanograms per deciliter, provided your free testosterone is also adequate. Free T is the unbound hormone that your body can actually use, and a good free T level is essential for feeling the full benefits of the therapy. If your total T is high but your free T is low, you still won't feel optimal. This is often an issue related to another protein called sex hormone binding globulin, or SHBG. As men age, SHBG tends to increase, binding up more of that valuable free testosterone. A great doctor will look at your SHBG level and adjust your protocol to ensure that even with high SHBG, enough free testosterone is available to your cells. This level of detail is what separates general practitioners from specialists in men's vitality. If your physician only checks total T, you are only getting half the picture. Demand the full panel. The complexity of SHBG leads us back to the reality that TRT is not just a simple matter of injecting a hormone. It is a balancing act. Your thyroid function, vitamin D status, and overall metabolic health all interact with how your body utilizes testosterone. If you are severely deficient in vitamin D, for example, your entire endocrine system will suffer. TRT may help your symptoms, but it won't be maximally effective until those other deficiencies are also addressed. This is why a holistic view of your health is always the best strategy. Never accept a simple diagnosis or treatment plan without considering the supporting pillars of your health. We must also touch on the long-term cost, as this is a practical reality for men over 60. Since TRT is a long-term commitment, the expense can add up. Some of the newer delivery methods, like pellets or high-concentration gels, can be quite costly. However, standard testosterone injections are often very affordable, especially when compounded or purchased generically. Talk openly with your doctor about the most cost-effective solution that still provides stability and safety. Do not compromise on monitoring just to save money, but ensure you are choosing a delivery method that is sustainable for years to come. Finally, we need to address the social stigma that still surrounds TRT. Despite the scientific evidence, many people associate it with vanity or cheating. As a man over 60 committed to maximizing your health and longevity, you must dismiss this noise. Treating a confirmed hormone deficiency is no different than treating low thyroid or high cholesterol. It is responsible health maintenance. Do not let outdated societal judgments prevent you from pursuing a treatment that could significantly improve your quality of life. Your vitality is yours to master. Taking this step is a sign of strength and discipline, not vanity. This journey starts with education, which you have just completed. Now it requires action. If this video clarified the confusing landscape of TRT, please share it with other men who might be struggling with these same lies and fears. We need to spread the truth. The complexity of managing hormones efficiently after 60 also involves understanding the concept of andropause, which is often used interchangeably with low T. Andropause is a more accurate term for the gradual, slow decline in male hormones that happens naturally with age. Unlike female menopause, which is a rapid, dramatic drop, andropause is subtle. It makes identifying the cause of fatigue much harder. This is why we caution against assuming every symptom is purely hormonal. If you gain 20 pounds and stop exercising, your symptoms might be behavioral, not hormonal. TRT is best suited for men whose testosterone levels drop significantly below what is considered optimal, often accelerating the symptoms of natural aging. To truly master your health, you need to conduct a personal inventory before your doctor visit. Write down every symptom you are experiencing. Do not just focus on libido and energy. Include things like joint pain, difficulty sleeping, reduced recovery time after exercise, and any shift in mood or mental sharpness. A detailed symptom list provides a clearer clinical picture for your doctor than just a single blood test result. This prepares you to be a fully engaged partner in your own healthcare. Let's look closer at the potential risk of prostate enlargement, or BPH, which is benign prostatic hyperplasia. This is a very real concern for men over 60, and it is frequently linked to the fifth lie we busted. The old, flawed theory suggested that adding testosterone would fuel prostate cancer growth. Modern evidence shows that this relationship is far more nuanced. TRT does not cause prostate cancer, but if pre-existing, dormant cancer cells are present, adding testosterone might accelerate their growth. This is precisely why responsible doctors require a baseline prostate-specific antigen, or PSA, test before starting therapy. If your PSA level is elevated, further investigation is mandatory before TRT can be considered. Once on therapy, your PSA will be monitored regularly alongside your hematocrit. If your PSA remains stable, TRT is generally considered safe. If it rises sharply, the treatment must be suspended immediately. Again, the shield against risk is always diligent, long-term monitoring. Do not accept TRT without a clear plan for regular PSA checks. For men who are hesitant about medication, remember there are always foundational, science-backed steps that can naturally support your remaining testosterone production. Heavy resistance training, especially compound lifts like squats and deadlifts, provides a massive hormonal stimulus. Certain minerals like zinc and magnesium are crucial precursors for testosterone synthesis. Ensuring adequate intake of healthy fats, particularly monounsaturated and omega-3s, provides the raw material needed for hormone production. These are not alternatives to TRT if you are clinically deficient, but they are essential components that should be maximized, whether you are on therapy or not. Your commitment to your health is a marathon, not a sprint. Every decision you make, from the food you eat to the doctor you trust, is an investment in your future vitality. Do not allow fear or false information to guide those investments. Use the facts we have provided to walk into your doctor's office with confidence and demand the comprehensive, evidence-based care you deserve. To truly bring this knowledge into action, let's detail the two phases of the TRT journey. The first phase is stabilization which lasts roughly the first 3 to 6 months. During this time, the goal is simply finding the right combination of dose and frequency that keeps your blood levels steady and resolves your most pressing symptoms. You might feel a little erratic during this time, with some days being great and others less so. This is normal, as your body adjusts and your doctor fine-tunes the protocol based on those initial blood results. Patience is absolutely essential in this phase. Do not panic if the first 2 months don't feel perfect. The second phase is $optimization and maintenance which is everything that follows. In this phase, your symptoms should be largely resolved, and your lab work should be stable. The focus shifts entirely to long-term safety and maximizing quality of life. This means ensuring your diet, exercise routine, and sleep are all supporting the work the hormones are doing. Maintenance is not passive. It means continuing that 6-month blood work regimen, to ensure that risks like elevated hematocrit or unstable estradiol levels remain neutralized. This is the difference between surviving and thriving. We must also touch upon the relationship between TRT and other common medications for men over 60. Many men take blood pressure medication, cholesterol reducers, or diabetes drugs. Generally, TRT is safe to use alongside these medications, provided the monitoring is thorough. However, if TRT significantly improves your metabolic markers, such as reducing your body fat and improving insulin sensitivity, it is possible you may be able to reduce or even eliminate some of those other medications over time. This is a huge, long-term benefit, but it must be managed strictly by the prescribing physician. Never adjust your existing medications without their explicit instruction. TRT offers the chance for systemic health improvement, but it requires coordinating care with all your specialists. Remember the specific promise of the channel: boosting vitality, improving mobility, and mastering nutrition. TRT, when indicated, is a powerful tool to achieve the first goal, vitality. But vitality is only possible if you maintain mobility. The improved strength, endurance, and faster recovery time that TRT offers should be immediately invested into a structured mobility program. Do not just lift heavy weights. Ensure you are working on flexibility, balance, and range of motion. Use the newfound energy to walk further, stretch longer, and engage in activities that keep you nimble. This holistic approach ensures that your increased lifespan is matched by an increased health span. The world of men's health information is loud and conflicting. Our commitment is to remain your definitive, evidence-based resource. If you have been misled by any of the 5 lies we debunked today, recognize that you now have the power to course correct. The path to optimal health is always open to the man who seeks knowledge and is willing to put in the work. The journey of mastering your vitality requires you to be your own greatest advocate. If you are discussing TRT with a doctor, pay attention to the level of detail they provide. Do they explain the difference between total and free testosterone? Do they immediately talk about monitoring your hematocrit and PSA? If the conversation is rushed, vague, or focused only on quick symptom relief without addressing long-term safety, this is not the right partner for your health journey. Look for a physician who sees you as an individual, not a textbook case. A final crucial factor related to the myth of the guaranteed fix for libido is managing expectations with your partner. TRT can significantly improve desire and performance, but it may take time. More importantly, intimacy involves emotional and psychological components that hormones cannot fix. Communicate openly with your partner about the process, the timeline, and the positive changes you are experiencing, focusing on improved energy and mood, as well as physical changes. A supportive partner is one of the greatest accelerants to the success of any medical treatment. We have covered the dangerous lies, the necessary monitoring, and the holistic commitment required. You are now equipped with the facts necessary to make a sophisticated health decision. If you found this information valuable, click the like button right now. It is the single best way to ensure this science-backed truth reaches more men who are being misled by misinformation online. Remember, taking control of your hormones is an active choice, It is a decision to demand more from your life after 60. Subscribe to Gentleman's Vitality for daily expert strategies on mastering your health. Do not settle for decline. Fight for your vitality. Live stronger, healthier, and more vibrant every single day. We must reiterate the importance of ruling out other conditions that mimic low T. This step is often skipped in the rush to treat symptoms. Before committing to a lifelong hormonal therapy, you and your doctor must confirm that your fatigue isn't simply uncontrolled sleep apnea, hypothyroidism, or chronic high stress. These conditions share many of the same symptoms as low T lethargy, mood issues, and weight gain. If you start TRT without treating an underlying thyroid disorder, the therapy will be dramatically less effective, and you will be treating the wrong root cause. Demand a full metabolic panel and thyroid check alongside your testosterone test. This due diligence protects you from unnecessary treatment and ensures the greatest possible benefit from any intervention. The long-term success of TRT hinges on adherence and consistency. Because hormone levels are influenced by so many external factors, sleep, stress, weight, it is helpful to keep a simple symptom journal. Note your energy levels upon waking, your general mood, and your strength in the gym. If you notice a consistent negative shift, you can present this data to your doctor during your next checkup. This concrete evidence is far more useful than vague complaints about feeling off and allows for precise dose adjustments. Your input is crucial for maintaining the delicate balance required for optimal results. For men who may not be candidates for TRT due to pre-existing conditions, such as certain cardiovascular issues or active prostate cancer, hope is not lost. The focus then shifts entirely to maximizing natural production and aggressively managing symptoms through lifestyle. The principles remain the same: superior sleep, heavy resistance training, and targeted nutrition. Even without external testosterone, optimizing these three pillars can elevate your natural levels enough to significantly improve your quality of life and stave off the worst effects of hormone decline. This is why our channel emphasizes these fundamentals every day. Finally, consider the legacy of health you are creating. By taking aggressive, educated steps to master your vitality, you are not just helping yourself, you are modeling strength and proactivity for your family. Show them that aging does not necessitate frailty. Show them that science and commitment can unlock continued vigor. This powerful positive example is perhaps the greatest benefit of all. Continue to seek the truth and never stop fighting for your best health. A practical note on communication with your insurance provider. TRT, when prescribed for clinically diagnosed hypogonadism, that is, confirmed low testosterone along with debilitating symptoms, is often covered by most major insurance plans. However, coverage can vary widely depending on the delivery method. Injections are typically the most affordable option. Gels and newer delivery systems might require prior authorization or may be classified differently. When you speak to your doctor, ask for the ICD-10 code they plan to use for your diagnosis. This allows you to call your insurance company beforehand and clarify your out-of-pocket costs, removing a major source of financial anxiety that might otherwise interfere with your commitment to the long-term protocol. Dealing with the administrative side of health management upfront is a hallmark of a proactive gentleman. One final check on the cardiovascular myth. Be aware of the testosterone-boosting supplements found at grocery stores or online retailers. These products are often unregulated, rarely contain effective doses of active ingredients, and can sometimes be contaminated or contain hidden compounds. They are not a substitute for prescription TRT and should be avoided. Your focus should be on confirmed, science-backed nutritional support, like the zinc and magnesium we discussed, or on pharmaceutical-grade therapy if your deficiency is clinically proven. Do not waste time and money on unproven miracle pills. Trust the blood work, trust your doctor, and trust the science. The entire landscape of vitality after 60 demands clarity and commitment. You now know the key lies, the performance-enhancing myth, the roid rage, fear, the guaranteed fix illusion, the prostate cancer scare, and the short-term commitment mistake. Replacing these lies with factual knowledge empowers you to lead with confidence. You have the knowledge to decide if TRT is right for you, or if lifestyle optimization is the necessary first step. If you found the comprehensive approach we outlined helpful, please subscribe to Gentleman's Vitality. We are committed to giving you the unvarnished, science-backed truth every day. Take this information, act on it responsibly, and continue to master your health journey. Let's consolidate the actionable plan. If you suspect low T, your mission is fourfold. First, secure that morning blood test, requesting the full panel, including total T, free T, SHBG, PSA, and hematocrit. Second, refine your lifestyle fundamentals. Optimize sleep, nutrition, and resistance exercise for a minimum of 60 days, proving your commitment to the foundation. Third, find a doctor who specializes in age management or hormone replacement, someone who views you as a unique individual, not just a set of numbers. Fourth, if therapy is indicated, commit to the long haul, treating the process with the rigorous monitoring it demands. The payoff for this disciplined approach is profound. It is not just about muscle or energy, it is about cognitive resilience. It is about enjoying your later years with a sharpness of mind and an eagerness to engage with the world that defies expectation. It is about truly living a vibrant life. We have presented the complexities and the truths. Now the execution is entirely up to you. Do not let another week slip by defined by fatigue and low motivation. Take this knowledge and apply it today. We are here to support your journey. If you appreciate the detailed, no-nonsense approach of Gentleman's Vitality, like this video and share it. This community thrives on shared knowledge and mutual accountability. Never stop striving for your personal best. Your vitality awaits.